So let's talk about another supplement we've seen a lot on social media and the internet, men's health, you name it, creatine. The problem is that it's often stopped before surgery for various different reasons or people's concerns, but should it be? And the answer is no, that's incorrect. And this is a really important supplementation for both people in their recovery process or athletes that are recovering, or from a surgical standpoint. So for myself as a surgeon, I take creatine. I'm really pleased with the results and the enhancements that I'm getting from it. But also it's important from a recovery standpoint for my patients. But the key here is to understand a little bit better. So really what it does, it increases phosphocreatine availability. It improves muscle energy buffering. It reduces the muscle loss during mobilization and enhances your rehab gains. And really the evidence highlights how it can attenuate muscle atrophy during disease if you don't appropriately load it, and then improves lean muscle mass retention post-injury. And there's really no evidence, again, this is something that was in sort of a myth, is kidney harm. If you keep the dosage appropriate, which we'll talk about, and you well hydrate, there is no concerns for kidney issues with taking appropriate amounts of creatine, especially with the doses appropriately. So again, pre-op recommendations or post-operatively, 3 to 5 grams per day. You can load up at the beginning, especially when you're doing some enhancements or you're starting to do more exercise. Again, more of the post-operative protocol. And it's really valuable, especially for lower extremity surgeries, which again, I'm involved with the majority of the time. And the exception, obviously, is if you have kidney disease at baseline, it can be troublesome to clear from the kidneys if you don't have healthy kidneys. So you need to be careful of that and maybe ask your primary care, or if there's a certain surgeon-specific combination that people are worried about. But overall, it's something I really recommend to my patients, and I've seen very good results with this. Again, it's one of the most underutilized preoperative supplements in orthopedics, and the results and the data are very compelling.